A CDC advisory committee just wrapping up day one of discussions on whether to recommend a booster shot of Pfizer's COVID vaccine. Last week, an FDA panel recommended it for people 65 and older with a high risk of contracting severe COVID and at high risk of being exposed at work. Well, now the CDC has to give its own recommendation. The group will meet again tomorrow from noon until 3:30 p.m. and we'll have the results of the meeting on air and online at 11alive.com.
There are more than 3,000 new COVID cases in Georgia today and thousands more sick with COVID-19 in our state, many desperate to feel better. But it's proving hard to find a treatment that could help. Caitlin Ross is looking into whether there is a monoclonal antibody shortage in Georgia. People are hearing about this. Is that, though, in fact the case, Caitlin?
Cheryl, the demand for these treatments is really high. It involves an infusion of synthetic antibodies proven to be 70% effective at keeping people from getting severely sick and keeping them out of the hospital. But there are pretty strict parameters around it. The patient has to test positive for COVID, be over 12, and get the infusion within 10 days of being infected before they get seriously sick. But despite its effectiveness, people wrote to 11 Alive frustrated. They either couldn't get the treatment or their doctor wouldn't prescribe it. So we went to the Georgia Department of Public Health to figure out what was going on.
There is not the inventory of monoclonals that there was just 2 weeks ago. And so we are working as hard as we can to allocate as much product as possible. But the federal government decides how much each state gets each week, and that's what we have to work with, and it's less than what we had before.
Dr. Rustin says the state is only getting about 70% of the inventory they're requesting, and that's leaving a lot of people stuck. Tonight at 6, we'll hear from a family who says they're being left out of the treatment and where your best bet is to find it.